Hi, I'm Dr. Sherba. We're doing our Instagram takeover today. We're going to take you through our usual day. We're going to start by doing a couple of follow-ups from surgery last week, and then we'll mark our tummy tuck for later today. The operating room is getting ready. The staff is ready. We're going to go ahead and mark the patient now. And let me introduce you to her. Come on in. So this is Katie. We're going to do a tummy tuck today. We're going to use some liposuction fat to inject in her face, and then we'll do a laser peel all at the same time. So we marked our initial marks with Katie. She's now putting on her undergarments to make sure that the scar is going to end up right where she wants it. And then we'll mark for liposuction, and then I'll have you guys come in. Okay, markings are done. I'm going to take the team in. We're going to review all the markings with the patient and make sure we're all on the same page. The areas that stand out currently are up here, here, and a little bit lower on the buttocks than we usually go, and then inner thighs. So we'll take a little bit of that fat and we're going to use it for facial fat grafting right before the laser treatment. Let me have you turn to the side just so we can see how far back we need to prep, all the way back here. And then let's turn the other way. All the way back here. She wants to keep her, go ahead and turn back towards me. We're going to try to keep her scar nice and low. This marks where she usually wears her underwear. So we're going to try to keep her scar lower than that. And do you have any questions?
No.
Okay. All right. Okay, so this is Janine. Janine helps me with all the laser patients and many of the patients with facial fillers. We've reviewed her plan on the computer, and what we'll be looking for is good quality fat so we can transfer into her face. Do you have anything to add?
No, while she's asleep, we're also going to be doing some laser resurfacing of her skin to help the texture and some fine wrinkles, and I think she's going to have a fabulous result.
What kind of laser plan did you guys put together?
So we're going to do full ablative resurfacing on her face using erbium laser, and we've already done phototherapy before so that we don't have to have her under anesthesia while we're doing some of the things that can be done when she's awake. And the resurfacing is a little bit more aggressive, so she'll be asleep for that portion of it. And hopefully she'll have beautiful, smooth skin when we're done.
Okay, so patients back in the operating room, the staff is getting everybody ready. We reviewed the entire plan with the team with anesthesia. I'm reviewing her history and physical and her photos while the patient's going to sleep. It doesn't really matter who you are. We want to make sure you get through this operation safely so that you can tell your friends and we can keep helping patients. I do feel like these surgeries really let you live your best life. So why not do something like a tummy tuck if that's what really bothers you? And that's what we're here for. That's what board-certified surgeons, plastic surgeons do, and I feel like we do a great job, and that's why I think that you should look for that when you are searching for a doctor in your area. Okay, so the patient's prepped, we're getting ready. I'm gonna quickly wash my hands. And again, we're doing an outpatient office-based surgery in an accredited operating room, and we're using the same staff every single week. So we do the same operations week to week, and I expect safety every time. And kind of lets me sleep at night. It doesn't really matter who I'm taking care of, to make sure that we get a great outcome. Getting ready. We're going to go into the operating room. We're going to do a tummy tuck, harvest some fat with liposuction from inner thigh, flanks. We're going to take that fat and use it for facial fat grafting and then do a laser peel. Okay? All right. Let's have a great day. Okay, we're going to do a quick timeout. That kind of covers the operative plan with the team one more time, and then confirms the patient and the plan, and then we'll get started. Okay, timeout is done. We've confirmed that antibiotics are in, that the boots are on the calves pumping for circulation, and the team is on the same page. Let's get started. Okay, so we've got the skin elevated off the abdominal wall, and then we also have the muscles marked where we want to tighten them. So the next part of the operation is to tighten up the muscles, and she also has a little bit of a hernia just above her belly button that we didn't know about before, so we'll fix that too. So I thought I was done. I asked my team if we should add just one more layer of stitches just to make sure that things are good and nice and snug, and will stay that way as she heals. And we couldn't decide, so we're just gonna add the layer anyway. And I always feel like you have to make decisions during surgery that let you sleep at night and let the patient sleep at night. And I know for sure that with this next layer, everything will be snug until she's totally healed. Okay, we got the tummy tacked together. The majority of it sewn already. What we're going to do now is liposuction the flanks along the preoperatively made marks. And once we have that done, then we'll quickly sew up the very edges of the incision, sew in the belly button, and we're through. So we have the liposuction starting. We injected the tumescent fluid. Now we're going to loosen the area with a technique called safe liposuction, which I learned from Dr. Del Vecchio. And seems to make things a little bit easier for harvesting fat. We're harvesting the fat into a closed container that's sterile, getting it ready for fat transfer. We're going to take a good look at that fat before we transfer it, because she does not remember which areas had prior liposuction. So her inner thigh fat might be a little bit better of a donor site for her fat that we actually transfer to her face. What we have left to do is just inset the belly button, which we marked on the midline of the body. And so right in there is where we'll inset the belly button. You have a new belly button. Okay, we're on our last little task with surgery. We're going to tumescent her inner thighs and harvest the fat for fat graft to her face from the inner thighs. Okay, so surgery's done. She had a great tummy tuck, great fat that came from her inner thighs. The fat from her flank area was a little bit beat up, so we're going to use the fat from her inner thighs to plump up her face. And then we'll finish with the laser peel. The surgery's done. The patient's in the recovery room doing great. I'm going to quickly get changed and we're going to start clinic.